All right, it looks like we are live. Hey, everybody, my name is Dr. Tim Pavlak. I'm here with Dr. Mike and Dr. Nilesh Shah over at Summa Sports Rehab and Medicine. And we are kicking off our first episode of 5-minute Tele-Physio Talks. This is key phrase, the longest title for the shortest interviews, coined by Dr. Mike. So if you guys don't think it's funny, it's not on me, it's on him. So we have a couple of quick and easy questions for Dr. Shah, who took the time to be here. We're going to roll through those and maybe do some follow-up questions at the end if we have anything. So, Mike, you have your standardized list of questions and all the surprise ones too that we didn't tell Dr. Shaw about that you're going to fire.
Get ready, hard-hitting ones. All right, Dr. Shaw, we've had the privilege of working with you quite a bit through, I guess the couple of years that the clinic's been running. So for the athletes we've had who've gotten to work with you, they know who you are, obviously, but why don't you tell us a little bit about who you are and what type of athletes you work with?
All right. First, thanks for having me on, Tim and Mike. I appreciate the opportunity to hang out with you guys a little bit via long distance and via video, so we don't get too close to each other. As you said, my name is Dr. Nilesh Shah. I am the medical director for Summa Sports Medicine. We also train the next kind of up and coming sports medicine physician. So I'm the medical director and I'm also the fellowship director for that fellowship where we're training the next group of sports medicine providers coming up. I'm also the race director for the Akron Marathon, for the Akron Marathon race series, as well as I'm a team physician for Kent Roosevelt High School, as well as the Akron Arrows, or actually, oh my gosh, I can't believe I said Akron Arrows. Akron Rubber Ducks, I'm so used to saying Akron Arrows, but Akron Rubber Ducks, have been taking care of the Rubber Ducks and when they were the Arrows since pretty much 2005. So I've been taking care of them for quite a long time.
I would tell you that we would edit that out, but we have no idea how to edit anything. So I'm sorry about that.
That's all right. People make mistakes. It's all right. I'm good with it.
Yeah, exactly.
We got a gracious community. I think they'll let you off the hook on that one.
Right.
All right. Well, okay. And you can kind of take this question whatever direction you want, but I guess what we're saying now is, what are you currently doing to keep your athletes healthy? And you can take that from hey, this is, on a normal day what we're doing, or also in light of everything going on right now with COVID-19, kind of whichever direction you'd like to take, feel free.
Yeah, especially with the COVID-19 piece, we're really, as everybody knows, everything is shutting down. Even from the medical side, in our offices currently, we're pretty shut down in our offices. We've canceled, honestly, basically a month's worth of patients. So the previous 2 weeks and the next 2 weeks, we've pretty much canceled everybody out of the office. If somebody has an emergent orthopedic related problem, then we are seeing those patients, whether or not that's somebody with a fracture, recent car accident or something like that, somebody who's having severe pain of some sort, or we've had some patients who've had their total replacement canceled because we're not doing elective surgeries right now. And so they need something to help them through. So whether or not that's an injection of some sort, we're obviously doing those kinds of things. Even though I'm in my office right now and I have my door closed right now in the office, we're supposed to have when we're seeing patients and walking around the office, we are having our N95 masks on to see all patients. We actually get our temperature checked before we actually walk into the office itself. So if I walked into the office today and had a temperature of 100, I would have been kicked out and sent right back home to self-quarantine myself. But thank God I don't have that right now. I'm not having any issues. But we're really pretty much quarantining not only our staff, but even the providers. So as physicians, we're kind of working on a team basis where I'm working part of the week and then another team member will work another part of the week. So just in case one of us got sick, we wouldn't infect the whole office. And so we're really trying to self-distance within the office and between providers. So even my orthopedic colleagues who work in our practice, they're breaking themselves up into teams as well, so that 1 week one team would be on and another week another team would be on. So again, as to protect not only our patients, but our staff as well as our providers, and try to keep everybody healthy as much as possible. Personally, as a runner, I usually run with the running group that I have that I run with, probably at least 3 or 4 times a week. We've all kind of said, all right, well, we'll catch up after this is all over. So a lot of solo runs, which I used to be a solo runner, and then I started getting into the group runs, and now I can't believe I used to be a solo runner, and it's really difficult to do that. I'm like, all these runs by myself, I'm like, I don't have anybody to talk to. So it is, I've taken it to and I think most runners have done that too, say, look, we're just going to have to stop meeting together and doing a lot of solo runs.
Mm-hmm. And in this situation, normally we don't run with you, but what could be convenient is because you're significantly faster than us, we could be a great people to run with at this point, because you'd probably be at least 6, 12, 20, 100 feet ahead of us at all times, at any moment.
Not so sure that'd be that fast, that far ahead of you guys, but that's nice of you to say that. But yeah, we've joked about that during some of our runs, especially some of our hard runs, we end up all strung out anyways, even though we're quote unquote running together, we're all strung out far enough apart, but we're trying to be smart about it and just kind of keep our distance from each other.
Yeah. And I guess a little follow up with the idea of, maybe we're running by our own. If we are, following this stay at home ordinance, and maybe we're not seeing as many people in the clinic as we'd normally be seeing, more emergent stuff. Do you have anything that you have homework or technique wise that you can have an athlete doing at home to allow them to recover well and continue to push performance, maybe if they don't have as many outlets to get that help as they normally do?
Yeah, what my fellows would tell you, and they joke with me about this all the time, I always harp on the gluteus medius. They say anything below the waist for a runner, I say it's the gluteus medius. It has something to do with their problem. I don't care what it is, if it's their ankle, if it's their knee, it's their glutes that are part of the problem. And they joke about that. They say, oh, their big toe hurts. It must be the glute med, right, doc? And I'm like, well, yeah, probably. It probably has some influence in there. And so kind of taking that funny idea further and saying, really, and again, I know you guys harp on this a lot with your athletes that you guys see. To me, it's all about core and gluteus medius. All of our motion starts and stops from within our core. Our gluteus medius is an area that tends to be weak, especially a lot in our runners. And I'm trying to figure out the chicken or egg on that. And I still haven't figured that out and trying to truly understand why the glute is so weak on their injured side. Is there some kind of inhibition that occurs that the nerve input doesn't, kind of starts to drop out, and that's why the glute gets weak on their injured side? So when somebody comes in with a knee problem and I tell them, hey, here are these exercises I want you to do for your glute, sometimes they look at me like, do you remember that my knee hurts? Like, why are you giving me the stuff for my core and my glutes? And I say, it's all interconnected, and I understand that you got to help me kind of go with me for a little bit and understand the method behind the madness. That to me, the glute med is kind of the source of all evil. And if I could do one thing for my runners, I'd say spend a little more time on your core, a little time on your glutes, especially the gluteus medius. And you can get online and Google gluteus medius exercises and find tons of stuff. And I know you guys have tons of great links for that kind of stuff. That's to me what I would say. If you had time now that a lot of us have a lot of extra time, that's where I would spend your time, is working on that kind of stuff.
Mm-hmm. Absolutely.
Perfect. Awesome. Well, those were our, we actually didn't plan who's going to wrap this up. I'm just thinking about that right now. And so I'll take that job upon myself. So Nilesh, thank you very much for the continued partnership with us and seeing our athletes and sending people back and forth, and for just taking care of the running community in Northeast Ohio in general. We appreciate that from you and everything you've done for us. So thanks for taking the time. Mike, do you want to go ahead and hum our theme song as I figure out how to turn this video off?
I don't think
Yeah, exactly it. All right. Thanks, everybody. We'll see you guys tomorrow.
Yeah, thank you guys for having me on again. And again, as you know, your runners love to come in to see you guys because they know you're in the community and you guys are runners as well. And I think I get benefit from the same thing. They come to see me because I'm a runner, and they know that we kind of get it. We know what they're looking for. We know what their goals are. And it's easy for anybody to tell them, any doc or any provider, to say, well, just stop running. Of course, that's the easy answer. Yeah. And that's what I try to teach my fellows. I say, look, we make our money because we're not going to tell them stop running. We're going to say, here's how we can keep you running safely. And sometimes I do it, right? You have a stress fracture, you're going to have to stop running. But there are ways that we can try to help keep them as active as possible through their process. And you guys do an amazing job at that. So again, I appreciate, and hats off to you guys for the stuff that you do.
Yes. Thank you, Nilesh. That was way better than Mike's theme song.
I'm working on it. Wait for episode 2.
Sure. All right. Yeah, I'll bring my parents on that. All right. See y'all. Thank you.